by Bradon Roberts, who is the Tobago tutor representative. Good morning, Mr. Roberts. How are you?
Good morning. I'm all right. Good morning, Ms. Gray. Good morning to the viewers and listeners.
Okay, so yesterday we got confirmation that SEA will take place as scheduled on the 1st of July, but there are certain stipulations. Children will have to wear their masks throughout the exam. The exam is a 3-hour exam that begins at 8:30. Children have to be there by 7:30 for the latest, and if any child is either ill or seems to be symptomatic, they will either be barred from entering the exam room or removed from the exam room if they present symptoms throughout the 3-hour period. What are tutors' concerns with these rules, or are there any concerns with these rules?
All right, so there are concerns with the rules, but before I go to that concern, my first concern would be the approach of the minister and the ministry, in that tutor would have asked for a meeting before. The meeting would have been put off to a later date. I think our meeting is actually Thursday. Then to come out with a press conference, put out these stipulations and so forth without having that collaboration, because it is important to have a good relationship with the various stakeholders so that at least we can bring the other things that would be overseen. Because we know that the exam is of great importance to different sectors. We also have teachers who are eager to have the exams over it. So it's not that tutor is against a particular date, but we are in support of set conditions. You would have opened the interview with the fact that our numbers are still pretty high. However, if the date is being maintained, which I see that the ministry is going steadfast with, we need to ensure that the protocols are properly detailed. So the protocols, as highlighted, they look good at face value. However, the actual rollout, and I saw a good deviation from answering that question when it was asked, in that what happens at the entry? Who would be the persons doing that initial screening? For the bigger schools, what would that weight on the outside be like? These students, and we know what happened with the vaccine rollout, it's not robots where you put a set guideline and expect that will be followed to the T. So we have that one concern. We also know how we have been operating. Persons are wearing the mask, they pull it down to talk, who would be monitoring each child, especially during that break, to ensure that they are all doing what they are supposed to do. Just to even go a little further before I allow you to ask another question. We know about the proverb where we hope for the best, yes, but we prepare for the worst. And I am not seeing that preparing for the worst part of it, because I do not believe that one doctor and 2 nurses per district is where we're preparing for the worst. What is really in place should there be any type of scare at any of the schools?
I think that's a very valid concern. The thing that flagged to me was how they plan to deal with children who look ill prior to entry to the exam or appear to develop symptoms throughout the exam. These children will be either barred from entering the room or removed. Now, I understand that from a public health standpoint, but what is the effect on our children? That is something that has flagged to me. What are tutors' response to that?
And well, most of all, we are in a pandemic. So while we will understand the effect on some of the students for the exam, the real concern is health and safety. And these same students...
But mental health is also part of health and safety.
Well, okay, yes.
And when you and that's why I said I understand why, there's a need to immediately isolate and remove the child. But the pandemic has been very taxing on adults. So I can't even, and we haven't been really talking about mental health in children. Last week we had a conversation where the health practitioner who was talking to us flagged the issue of mental health and children as it relates to COVID. So I'm wondering if this is something that tutor will now have to take to the ministry, that their policies, while on the surface okay, could actually cause some additional damage.
And that, as I mentioned, it's unfortunate that they did not make provisions for the association to meet with them. Mental health has not been taken up seriously as is needed. Yes, we have the guidance officers who are doing as much as they can do to have that outreach, but there are a lot of students and there are a lot of persons who are not even coming out with that initial problem that they are struggling. So there are persons who have not yet been reached. So yes, we have an oversight as to what we want in terms of an exam and how we want to structure the education system based on what is current. However, there are factors that are being overlooked just to ensure that they get marks for these students so that they can decide which school they want to put them in.
Bradon Roberts, what are some of the health and safety protocols that tutor would like to see implemented that they think would make the exam on July 1st safer for our children?
Actually, the protocols outlined, they are fairly good. However, the main concern would be the numbers per classroom, especially where you have some students who would have a concession, where they would have a special arrangement, the ratio of that rollout. But the key thing to what have been planned is the actual rolling out of it. Who are the persons to do such? Is it the same invigilators or the testers who would have to do the screening and the monitoring of all the other aspects? I think the manpower is short, and it's even shorter concern considering that several of the teachers did not volunteer. To simply say we had a shortage before and then we have a shortage now, so we'll make it work, there would be increased risk on those who actually go out to ensure that this is done in a manner where we don't have that rise. And the rollout is what I am concerned about, because, I mean, things always look good on paper, but we are not robots. We have to ensure that we have the necessary in place to assist each other as best as possible to ensure the protocol is adhered to.
Now, CSEC exams are currently going on. How has that been? And are there lessons from that we need to be implementing for SEA? Now, of course, SEA is younger children, so there are adjustments that need to be made. But what are some of the lessons that you'll have learned from the CSEC exams that are currently taking place?
And just as I just mentioned, the actual rollout. So some teachers would have been commenting, for example, the practical areas. After the students interact with whatever object and whatever space and the sanitizing afterwards, it's actually the same invigilators who are doing that, and then to prepare in a timely manner to ensure the other grouping, depending on how much using a particular space at the same time, and it's ready for the next set of persons. So that aspect of it, most of the teachers would have been and invigilators would have been complaining about how that is actually being rolled out. So there have been some delays and some setback in that regard. Thankfully, we have not seen, and we would not see right away, the effects of any particular spread. But the concern so far is being able to adhere to the protocol in such a way where time of the exam is at its minimum.
Right, and then of course, like you said, there's a serious manpower issue. But if you have CSEC exams going on, as well as SEA exams, you have an additional strain, because in theory, you might have been able to maybe tap into teachers in the secondary school system to assist with the delivery of SEA, but that is no longer possible. Have your members been taking up the offer to be vaccinated ahead of the examination, especially with the view towards invigilating?
So the response to that is mixed. We would have been advocating that the vaccines are made available to our members. We would have gotten, especially in the Tobago space, I would have seen where the division would have sent out notice to the schools so that teachers who would have registered could be given that priority when the information is sent to the health officials.
Bradon, sorry, just really quickly, you said the response has been mixed. While it is mixed, is it more positive or negative? Is it slightly positive, more people are willing to be vaccinated, or slightly more people not willing to be vaccinated?
I really can't give a set figure.
Not even like, 50-50, 60-40?
Yes, it could be a 50-50.
50-50?
It could be, yes.
Not 60-40?
I may be able to shut the 60-40 because I'm getting mixed results, as I said, as I speak to the various
And
teachers.
which side do you think is more 60? 64 vaccination or against vaccination?
64.
Okay. Okay.
But to continue, the division would have made provision. However, I'm not certain how effective it has been, in that there are teachers who would have said that they would have registered 2 weeks out and have yet to be called or given that appointment date. I would have reached out to the SSG, who I know would have been doing some work with health officials to ensure that teachers are vaccinated. Some persons got their date pretty quickly, and we are still waiting to get positive feedback for those who have been waiting for some time.
So what time is your meeting with the education minister on Thursday?
I believe it's a 3 o'clock meeting.
Okay, so we're definitely going to touch base with you after, or with tutor after, to see what's the update on that, because this is a really serious development. A lot of parents, as well as children, are actually awaiting their exam, and the information on how the exam will be invigilated. Safety is very important. Bradon Roberts, thank you so much for joining us today.
Thank you as well.
Okay, so we're going to take a very quick break, but as we've been telling you for the entire week, June is